everyone, it's Kathy from Body Dimension Muscle Therapies. This video is going to really demonstrate to you how to breathe correctly. The reason it's so important to us is that when we're in pain or when we're confronted with a situation that makes us very nervous or agitated, then our breathing becomes affected. So our brain works on two major nervous systems. We have our sympathetic nervous system, which is our red alert. So that response that we get from our brain, it releases hormones, and there's like this cascade of events that happens internally where our brain sends messages down to all parts of our body to respond to that threat that's been placed upon us. So if you think of a situation maybe where you're walking down the street and you saw someone trying to break into your house, so your brain will respond to that threat in three different ways. So you either fight, you run away, or you freeze. And the actual physical effects of that response, our breathing becomes very shallow, our heart rate increases, and our blood pressure can rise. And the breathing, instead of being a normal quiet breath, tends to be more rapid, and it starts to move up into sort of our upper chest. So we're trying to basically survive that particular situation that we're confronted with, and the body needs to get air in as quickly as possible. Now when we're in pain, that system is exactly the same, and we tend to not associate it as much with being in pain as, say, the previous event where we're confronted with that event. And the breathing becomes dysfunctional, and the brain starts to shut down pathways that it feels it doesn't need in order to survive. So in terms of thinking, okay, well, I need to breathe into my diaphragm because that's the correct way to do it, we become dysfunctional in that breathing pattern. Our brain then starts to think that it's normal to breathe into our chest. So we're in that sympathetic nervous system drive all the time. So this has quite a long-term and short-term effects in terms of how we handle pain and dysfunction. So if we can start to move from that sympathetic nervous system into the other system, which is the parasympathetic nervous system, and that's more your chill-out system, and it starts to allow the body to feel as though it's not under threat, and you will go into more of a thrive mode where your body will start to become more functional, you'll be able to move more effectively, and the pain should start to reduce. But all the while you're in that sympathetic nervous system with this upper respiratory breathing, you can't be in the parasympathetic nervous system, and that's why a lot of people are always in pain, because their body feels that it's constantly under threat. So I'm going to try to explain how we should start to breathe and start to correct those patterns in order to bring us out of that red alert system and more into the parasympathetic nervous system. So what I'm going to do first of all is I've got one of these little massage balls. You can use anything. You can use a tennis ball, golf ball, and we're going to lie down and we're going to place this on our bellies. Now, I'm a Pilates teacher as well, most of you know that, but for this exercise I really want to focus on diaphragmatic breathing, because when we're breathing into the lungs, the pressure, as the diaphragm contracts, what's supposed to happen is that the pressure should go up into the abdominal wall, and you'll get this sort of rise of the belly. So using one of these balls or a tennis ball gives you that sensory perception, so you can actually feel where you're breathing into, because when you start to breathe you think, okay, I'm breathing into my diaphragm, but are you really? Okay, so if we place this, I'm just going to pull my top up slightly and just place this so you can see. I've just placed this right over my belly button to start with. Now, if I just start to think about how I breathe, at the moment I'm mostly a little bit nervous talking into my videos, so my breathing has gone, and I can feel this into my chest because I can feel my shoulders rising. So I'm going to just start to try to take a few deep breaths in, and at the moment you can see that this ball isn't really rising. So if I start to channel my breath through my nose, so I want you to notice what the ball is doing. Okay, so as I'm breathing in, I'm rounding my belly and I'm breathing out. And you'll see the ball sinking down. Okay, so the diaphragm is contracting downwards, touches underneath the ribs towards the spine. And because if we're not breathing into the diaphragm, then the actual back becomes very unstable because it attaches into sort of fascia and in towards the spine. Now once you've got this pattern of breathing first into the diaphragm, the breath should start to travel upwards. So we're looking for about 2/3 of the breath into the diaphragm, and then the chest should start to rise. Now what you may find is that the breath starts higher up by the ribs, then the diaphragm or the abdominals rise, and then the chest lifts. So it's trying to get that order correct. So it's the diaphragm, and then more up towards the breastbone, and then into the chest. Now one exercise that you can practice, because this actually encourages that parasympathetic dominance, which is what we want, is that you breathe in for 5 counts, then you're going to hold your breath for 5, and then you breathe out for 5, and then you hold your breath for 5. So that encourages the bronchi to dilate, which is a parasympathetic response. And by starting to do this type of breathing, if you think of where you are before you do this exercise in terms of maybe pain or aches, and note down on a level of 1 to 10 in terms of pain where you are. So it may be 5, it may be 8, wherever it is. And then after you've done this exercise, then think about how your body has responded just to the diaphragmic breathing, and I'm sure that you will see a huge difference. And this can be applied especially when you're sitting. If you work and you're sitting at the desk, then the diaphragm becomes dysfunctional because we're in this forward posture, so the diaphragm can't work properly, and again we go into this upper respiratory breathing because the body feels it's under threat because it can't get the air in, so it will get it in any way that it can, and it will be more up here. So by sitting and trying to expand through the thorax, then the diaphragm can work more effectively. So it does take a lot of practice. It's like anything, learning to drive or riding a bike. But it is a skill and it can be learned, and the breathing affects everything in our bodies, the actual acid and alkali levels in our blood. As I mentioned, that your back becomes very unstabilised if we're not breathing into the diaphragm, and we become into these faulty movement patterns. So I hope that helps, and as I say, this is the main threat to our survival. We need to breathe, and we need to try and breathe correctly. So I hope you found that useful, and I'll see you soon. Thank you.